Good afternoon, everyone. My name is Amr Elekiaby. I'm a respirologist, a yoga teacher. I study breathwork and meditation, and of course, still studying yoga. And in my medical practice and day-to-day life, I frequently encounter individuals who have trouble with sleep, whether it's falling asleep, staying asleep, or feeling refreshed after sleep. Of course, there are sometimes medical reasons for that are addressed by the medical system, but there are very frequently individuals who don't really have a medical issue. So I thought that it would be important to bring in some different practices from different professionals. And today I thought it would be a great idea to have Jessica Bugra with us. She is a great acupuncturist and traditional Chinese medicine therapist, and also a Ayurveda practitioner. Thank you, Jessica, for spending your afternoon with us.
Thank you. So my name is Jessica Bugra. I am a registered acupuncturist, an Ayurvedic counselor, and a life coach. The way I treat my clients is from a holistic perspective, which means I take into account your mental, your emotional, physical, and spiritual health, and the way your environment impacts you. And so today I'm going to talk about sleep and all the things that could potentially be impacting your quality of sleep and the reasons why you're having a difficult time with resting and repairing your body.
So how important is sleep? And really, from your perspective, what is sleep?
Yes, so sleep is more than just the opposite of being awake. Sleep is more than just resting. It's separate from resting, which we'll talk about. But sleep is a really important process that you need to experience and go through on a daily basis in order for your body to rest and repair itself. Without sleep, we have many imbalances. Sleep can slow down our prognosis with many diseases. So sleep is extremely important as breathing, perhaps.
So why are so many people these days having trouble sleeping? Particularly, they mostly mention that they're not able to still their mind and rest. So even, how can people address this?
I think we need to first start out by understanding where the difficulty lies. Are you having trouble falling asleep, staying asleep? Are you having a difficult time waking up? Are you groggy, tired, fatigued throughout the day? So there's different levels of sleeping disorders that need to be understood. It's not as simple as I can't fall asleep. That isn't, even if you're able to fall asleep and you're waking up tired, is also an imbalance with your sleep. And then understanding that sleep is more than just resting your body. Many people will go about their day and then just go straight to their bedroom and try to fall asleep without actually resting and detaching from their day. So understanding all the different factors that could be impacting your sleep. And it starts with your daily routine. It starts with how you spend your day. That all impacts your sleep.
Very interesting, thank you. Because, I talk to many patients, people, and I try and explain to them that, sleep is part of your life. Sleep is not, you're gonna turn off and turn back on again. So it seems there needs to be an investment in their day, preparing for their sleep, and not thinking that we can just, push through the day and then it'll all be okay and I'm going to fall asleep.
Right, because many of us go through a fight response. We're a very heightened response emotionally, mentally, physically, and then we're going throughout the day, and then we come home, have our meals and then go straight to the bedroom to fall asleep. Your body's still in a very heightened fight mode. And if you're going to force it to just close its eyes and try to rest, everything that you've been experiencing, all the mental and emotional thoughts especially, they're all gonna come up. They're gonna show up at that moment, because that's the one moment you've had of quiet time throughout your whole day. So often I encourage my clients to create a bedtime routine so they can detach from their day mentally, emotionally, physically. I encourage them to do this outside of their bedroom, but even away from their bed, to create some sort of routine where they can take a moment to rest their bodies, bring some ease into their bodies. And this can be through breath work or something even like doing skincare, just physically, mentally separating, reviewing their day, being grateful for the moment, allowing their mind to release any heavy emotions or intense emotions, just bringing some awareness into that. And so that when they do try to sleep, they've at least released all that high energetic energy that's been like trapped in, so that their body can now go into rest mode instead of being still in that fight mode.
Excellent. Thank you, Jessica. And so I do have some patients I talk to who tell me, we meditate, we do yoga, we read, we're mindful, but we still can't sleep. And I know this is not the majority of people, but what are like just simple options that might be available, or options that they could explore?
So I would invite them to bring some awareness on how they spend their day. What are they doing the first thing in the morning? What are they doing later in the evening? How are they spending their energy? What kind of meals they're having? All of these things can be impacting your sleep. The morning routine is something that people tend to ignore. They don't think it's important to your sleep. I genuinely believe it is, because it creates consistency. It is when you know that you're looking forward to something, there's something that you need to do, your body's a little bit more motivated, your mind's more motivated to get ready for that next day. This also helps to balance out your circadian rhythm. When your body knows that we're going to follow this specific routine, it knows how to spend its own energy, right? Sometimes some people might have a very slow morning and they're not doing too much, and they're not quite sure how they're going to spend their energy. All that energy that they had accumulated for that day shows up in the evening. Mm-hmm. So see it as that way, that there's a certain amount of energy that you need to spend each day, and plan for it. And especially use most of it in the morning. So I encourage a little bit of movement. That could be anything from doing some light stretches, breath work, exercising, or just even like a morning routine. Maybe there's some chores you have to do in the morning. Get your body moving in some way, right? And that encourages your body's natural processes and metabolism to start moving. And then it knows, like, we're going to do this and we're going to spend our day like that. And consistency is important because it keeps your mental health and your emotions grounded. And that can help your nervous system, which in turn helps your sleep.
Excellent. Yeah, it's very important these days to have a buffer zone, right, between your day, your sleep, but also so having buffer zones, having also being mindful during the day that, at some point you're going to need to sleep, and whatever you're doing during your day, what you're feeling, you're thinking, that will eventually affect sleep. And really everyone needs to invest in thinking about their sleep during the day, and not waiting till the last minute where, okay, you're faced with bedtime and you don't know what to do.
And I'd like to add on, it doesn't need to be complicated. It doesn't need to be some long process. It can be just like 1 minute of rest. You can start with that. It's the intention that I am, like, for example, what I like to do is in the bathroom, I'll do a skincare and I set the intention that I'm preparing for sleep. I am resting. And I'll just quickly review my day, and it's honestly about 2 minutes. But now that I've set the intention, my body knows that it's time to detach, and that now I can sleep a lot better. So nothing complicated, start slow. The intention is the most important part.
I totally agree. I think the intention is a true intention. In learning about the basic science of yoga, intention is key. So the other difficulty I think that most of us face, including myself, is consistency. Like committing, even when you find the solution, sometimes your mind will trick you into not sticking to your routine and doing something else. Don't be too hard on yourself. Let that go and keep trying. But always keep on thinking about what you can do to improve your sleep. Because the human body is amazing. You have a lot of tools, you have a lot of medications in your body that you can try and use by setting your intention, committing to a routine, practicing mindfulness. There's so much out there that also there might be things out there that we don't know about. So we're just trying to open up the discussion about why so many people these days are not having sleep. Thank you, Jessica, for all that information. So today, could you leave our audience here with some simple bedtime routine advice that can help?
For sure. I would start with some of the basics. So making sure that you're having a proper meal, you're well fed, because that's very important to regulate this process, the sleeping process. And then your environment, your physical environment, declutter, keep it organized, bring in some fresh air, maybe even throw on a scent, or keep it so it's a little bit more fun and exciting to be in that room. Because this is something you need to do every day. It's important to look forward to it. And so little things, just how the environment looks like, how it smells like, how it feels like, can really help bring balance back into your nervous system and help you feel relaxed and grounded. A few other things to try is to reduce blue light. So like no cell phones, have no TVs, reduce that before bedtime. I also actually recommend clients to cool down their body. So we're going throughout the day where even if the temperature outside is colder, our body's still full of energy. It warms up. So I encourage clients to take a quick shower, or to even massage their feet just to bring down that body's temperature, because in order to fall asleep, your body's temperature needs to be a little bit lower than it is compared to your entire day, right? I invite my clients to practice gratitude, again, to end the night on a better note, especially if you've had a really hard day. That's really helpful. Anything and everything to reduce the impact that stress has had on you all day, and to just relax your nervous system.
Thank you, Jessica, for the advice and all the helpful information. I would like to touch on some of the difficulties that patients with respiratory diseases have, but we'll just talk about one type of respiratory disease, COPD, which is quite common, and really addressing their daytime symptoms and addressing their medication routine during the day. Optimizing their medical treatment is quite important, because in COPD, changes happen within the airways. There are changes in the mechanics of breathing, leading to trapping of air inside the lung and hyperinflation. And so optimizing medical therapy can help with that, but also optimizing how you breathe and how you pace your activities. So for patients with COPD who experience shortness of breath, yes, you might need oxygen, might need inhalers, but it's really important that you pace your activities to avoid trapping too much air in your lungs and having your lungs hyperinflated, because that puts your chest muscles, that puts your lungs and chest muscles at a disadvantage. The other part is oxygen therapy. Patients with severe COPD or other grades of COPD might need oxygen therapy at night, and that can be easily assessed through a test done through a hospital in your area, just checking the oxygen at night and determining whether or not you need supplemental oxygen. That is not the same as CPAP or BiPAP. Some patients simply just need a little bit of oxygen at night, so that's something you could look into. In addition, really pacing yourself throughout the day, doing some breath work can really improve your respiratory health and also help your sleep. So thank you so much for sharing your experience with us.
Thank you.
And we look forward to having many more chats.